Welcome back to this week's episode of Hormones, Metabolism You. I'm your host, Dr. Cassie Smith. I'm a functional endocrinologist out of Oklahoma City. Today, I'm interviewing Dr. Tyna Moore. Many of you that listen to this podcast, I know of Dr. Tyna Moore. She is a huge advocate of GLP-1 usage and also hormone health. I got to ask her so many exciting questions, so I'm excited to share this interview with you. We started our interview talking about GLP-1s. We talked about what do they do? What are the positive things that they do? How do they affect your gut? How do they affect your joints? How do they affect your hormones? How do they affect your immune system and immune modulation in addition to weight? We transitioned to talking about what is microdosing of GLP-1s? What does that actually mean? Are people actually doing it correctly? And then we talked about what are the difference between GLP-1, so semaglutide versus tirzepatide versus retatrutide. And so she gave us her expert advice on these different peptides and what she's used and what she has not. We then talked about hormones. We talked about how GLP-1s are not magic pills and how in order for them to work correctly, your hormones have to be optimized and managed. And so we had a long conversation about hormones and hormone health, about the side effects of hormones, about the safety of hormones, about how hormones do not cause cancer, about different ways you can take hormones and Dutch testing, side effects of menopause, symptoms of menopause, sleep with menopause, estrogen, all things menopause. And she gave us a great perspective on menopause and hormone use. And then we finally transitioned at the end of our conversation to alcohol. We had a pretty long, in-depth conversation about alcohol, some of the studies around alcohol now, and how alcohol actually affects your hormones. So this podcast episode is packed full of so much good information. Dr. Tyna is just a wealth of knowledge. I love her content and I really enjoyed interviewing her. So I hope that you enjoy this podcast as much as I enjoyed doing it. Welcome to this summit episode. I'm your host, Dr. Cassie Smith. I'm a board certified endocrinologist. Thank you for joining us for the Hormones and Mental Health, Overcoming Anxiety, Depression, and ADHD in Women Summit. I am interviewing Dr. Tyna Moore today. She is a wealth of knowledge when it comes to hormones, and we are going to be discussing how estrogen impacts your body as you age and progress through menopause. I'm your host, Dr. Cassie Smith. I'm a holistic endocrinologist in Oklahoma City, and today I'm interviewing Dr. Tyna Moore. I'm so excited to have her. I've been waiting to have her on the show for a while. I've been asking you guys what you want to know, and so we have lots of good stuff to talk to you guys about. So she has nearly 30 years immersed in the medical field. Dr. Tyna Moore is an expert in holistic regenerative medicine and resilient metabolic health. She's licensed as a naturopathic physician and a chiropractor, drawing on knowledge from both traditional and alternative fields of science and medicine to provide a comprehensive perspective to individuals striving to enhance their health and well-being. Dr. Tyna holds degrees from the National College of Natural Medicine, an esteemed naturopathic medical school, and the University of Western States Chiropractic College. Her work's not just about treating symptoms, it's about understanding and healing root causes to build a robust foundation for long-term well-being. She's well known for her fierce and open-minded exploration of the peptides semaglutide/Ozempic as a longevity tool for healing. Dr. Tyna champions medical autonomy and individual accountability, and she's on a mission to help as many people as possible experience the freedom and joy that health brings. Dr. Tyna Show podcast, a top-ranking podcast in the health and wellness space, and an international speaker, she's dedicated to empowering others to take control of their well-being, heal their metabolism, and build strength and resilience. Her cornerstone recommendations for every patient and listener: weightlifting and sunshine. Additionally, she extends her expertise to support fellow doctors in cultivating their online practices, helping them transition away from the insurance-centric model to reclaim time, financial stability, and freedom. Dr. Tyna lives in Oregon with her husband and daughter and is a proud dog mom, which is another reason that I love her. She did a whole episode on her podcast about dog food, people. So you need to find her show and listen. But thank you for joining me.
Yeah, thanks for having me. I wish I had given you my shorter bio. I feel like that was a lot. So, thanks for having me, though.
Yeah. So I'm so stoked to have you. My listeners kind of know I've been kind of letting them know that you're coming on, and so they have some questions. And so there's a lot of things I kind of want to talk about today, and I know you're very well known in the peptide world, and we're going to talk about that just briefly. I'm going to get your expertise on a few things, but then I want to talk to you about a lot of other amazing stuff too: metabolic health, gut health, estrogen, the importance of that. I want to talk to you a little bit about chronic pain, and then just some other fun stuff. So I want to start with just in general, peptides, right? So GLP-1s, microdosing. My practice uses a ton of microdosed semaglutide, tirzepatide, and then we've even been using retatrutide. And so I guess from your standpoint, I would like, my listeners to hear from you. What do you think are some patient types that benefit from this? Is there a single person that doesn't? Is there a certain type of patient that benefits more? Like, what is your general answer to that?
So my experience with this is predominantly around using these peptides not as a weight loss strategy. In fact, I don't believe or have not found them to be very efficacious as a strategy for the whole host of, we've got the whole laundry list of other benefits that GLP-1s bring if somebody's not metabolically sound, if we're using a microdose. So all that said, I think with the folks who need to lose weight, I think low dosing, standard, and I guess it depends on how you define microdosing. The standard starting dose, and then the next tier up is what a lot of people are calling microdosing. That's not what I'm referring to. I'm referring to using a fifth to a tenth of the starting dose. So tiny little doses for a whole host of other conditions such as brain fog, because we've got the data to show it's, neurocognitive benefits and neuroregenerative benefits, as well as cardiovascular, potentially using it preventatively there, and a whole host of other things. I think that it really does require that an individual be metabolically optimized for that to work. And so I'm not sure what your patient base is like, but mine doesn't tend to have a whole lot of pathology around obesity and type 2 diabetes. My patients tend to be more already on the tip, like they're already strength training, they're already dialing in their sleep, they've got their nutrition dialed, and we just kind of sprinkle it on as an adjunctive tool for whatever it is that they really need it. So I'm using it more as a longevity and optimization tool in that regard.
Yes, I would agree with that. And I feel like a lot of our patients are metabolically pretty sound, or we're getting them there. We focus on this like 10 steps to health at our clinic. And so we start with cell membrane health, and we do gut health, and we, so we have them going down the right path. So we definitely don't use this as a, here's a drug, you don't have to do anything, you're going to lose a ton of weight. Right. I tell people all the time, like, if that's what you think, you're in the wrong clinic and this is the wrong medication. And if there really was one of those medications, then nobody would be overweight. 70% of the population wouldn't be overweight or obese, right? So I think my question to you, like, we see a lot of, like you said, brain fog, a lot of joint inflammation, a lot of, sleep issues, even a lot of GI issues, like a lot of people with bloating, gas, things like that, where it gets better. And to your point, not a starting dose, much lower than starting doses. So when we say microdose, we mean that as well. I mean, we're talking very, very low doses, not even close to what you can get from an actual pharmacy. And so is that kind of, in addition to longevity, what you're, seeing as well as far as like joint pain, brain fog, stuff like that?
Yeah, absolutely. I think it's remarkable for pain. And I think it's really cool, the impacts I've seen on folks' guts. It's funny because in the high doses, we're hearing about all the horrific side effects, and that's all you hear about in the media. But I'm like, yeah, if you're overdosing your patient, although I will say, even at tiny doses, I've seen people have some GI disturbance that maybe they weren't comfortable living with. And that's usually when I obviously go straight to testing and treating the gut. I think there's just a whole litany of system-wide issues that I don't even want to say issues. I feel like we need to optimize a series of systems within the body. Mm-hmm. And then GLP-1s work really beautifully. I feel like they also unmask sort of the weak spots, right? Like, have you found that with folks where they're sitting on the edge of hypothyroidism, or they're sitting on the edge of hormonal imbalance, or they're sitting on the edge of, maybe like low-grade SIBO, chronic digestive stuff. And then the GLP-1s, even at the tiny doses, sort of thrust them over the edge or at least expose those weak links. And in that case, that's where we focus, right? It kind of tells you, I mean, I usually know where to go just by symptoms, but it also will tell you where to go and lead you. And I think that's where a lot of folks who online say, oh, it's not working for me, or I'm having, I'm not feeling better on it, I'm feeling worse. I'm like, yeah, well, if your gut's really torn up and you've got a whole set of dysbiosis in there, then it's going to shift your microbiome. And while that's happening, can be a really uncomfortable experience depending on how, in like how much those bugs have dug in and how long they've been living there, right? And what microbiome milieu we have brewing, if you will. So I think that it's a really wonderful tool when somebody, and I shouldn't say that. I was going to say when somebody's metabolically optimized, but I've also seen it be the thing that starts the person on the path, right? Like I'm sure you get a ton of patients like that where they just need a leg up. They just need some help. And I've seen some folks who are really metabolically compromised or quite obese needing higher doses, more standardized dosing to move the needle. And they don't ever get a single gastrointestinal side effect. It's really remarkable. Like it's just kind of very much an individualized journey for each patient.
Yeah, I would agree. And then to your point, like I see these people who come in and they're maybe right on the edge of menopause or perimenopause, and you put them on this and that may push them there.
Yep.
And what I find too, I'm very interested in gut health. And so when you, especially as a woman, enter menopause and lose estrogen, testosterone too, but especially estrogen, and it messes with the estrobolome of your gut, you get all sorts of issues. And so you have to go back and really, look at that and look at, what symptoms are you having and do we need to address your gut? And so I talk to people, I saw a lady today who we put on a microdose and she's been on it for about a month and a half. And I thought she was perimenopausal. Well, she's definitely become full on menopausal. And she's like, this isn't working. It's causing this. It's causing, I'm like, no, actually that's because you have no estrogen now. Like it's,
yes,
you have zero estrogen. And so your estrobolome in your gut is a wreck. And that is why you're having all these gut issues. But then additionally, now you're having hot sweats or night sweats and you're hot and your skin is dry and it's a whole conglomerate of things. So to your point, like, I don't think enough people look at the body in lots of different systems, right? And I try to look at it as like a whole. So I'm actually writing a book about this now. I just finished the first draft last week, and it's all about how hormones in your gut affect everything. And so like when you lose estrogen, what does it do to your gut? And then when you change the estrobolome and the microbiome of your gut, how that causes, can cause leaky gut, can cause inflammation, can affect your thyroid. And so I just don't think that enough people look at that. So yes, to your point, sometimes I think these medications get blamed for things when they're unmasking things that we just need to fix.
I agree. And I think maybe this is just my hypothesis. Maybe one of the mechanisms is that it really does induce a healing impact on the body. And I'll take myself as an example. When I started microdosing GLP-1s, I was on probably for 10 years, I was on 2 grains of Armour thyroid a day for probably a good decade. And I was feeling like I needed more. Like I was feeling very hypothyroid, even though labs were coming back, it just depended on what my Hashimoto's was doing. I now can only handle half a grain, if that. So there's a healing cascade that's happening when we go on these peptides. And I think one of the big things I've been trying to share out with the world is the longer somebody's on them, the more of a healing impact they're going to have on different systems of the body. And when you shove a healing cascade, if all of the other cofactors aren't in place, or if you shove, if we shove any pathway and the other cofactors are not on board, we're going to have problems. If we shove thyroid, for instance, and we give somebody thyroid medication or hormone, but we don't support the adrenal glands, we're going to have problems. And I feel like this is kind of in that realm. Like if we're getting somebody on a GLP-1 and we're starting to see these shifts, and we know it heals up the pancreas, we know it heals up and helps regenerate pancreatic islet cells. We know all of these things are happening. We are seeing improvements in insulin reception and insulin production. And then maybe these hormones are off. I'm such a big fan of what you're saying, because I tell people all the time that message me and they say, it's not working. And I'm like, dude, you're not on HRT. I know you're not on HRT because I know the only thing you did was go in and get a GLP-1, try to microdose it. And now you're saying it's not working. First of all, what is it not working for? Second of all, do you have a good doctor on your team helping guide you on this? And I know we are few and far between who understand it, but number 3, like, where's the hormones? Because especially someone my age, Gen X, middle-aged woman, sitting there complaining about how GLP-1s are not making them feel great, or it's not doing what I seem to claim what it's doing. I know these, I'm like, how old are you? And they're like, oh, I'm 50. Why are you not on hormone? Why weren't you on hormones 5 years ago? You know, like, where are the hormones? I just
Right.
I think that's such a critical piece of the puzzle.
Yeah, and I think that's a lot of the problem, like with hormones, with anything in medicine, right? So with thyroid hormone, with HRT, and with these peptides, when you go to a med spa, no offense to med spas, but when you go to a med spa or you go to somebody who, learned how to do this in a 4-hour class, and that's the extent of their knowledge, and they just give you A and expect B, and B doesn't happen because in order to get from A to B, there are multiple other facets that you may have to explore, then that's where these things get a bad name, right? So as an endocrinologist, I clean up hormone messes all day, every day. I cleaned up 3 of them today. I mean, it's just like, but it's because I also understand the pathway, how they work. If there are side effects, then I understand, well, we need to go back and figure out, why are we developing this side effect? Was it the dose? Was it the type? Is it you're not metabolizing things correctly? And so, yes, to your point, it's very frustrating, because I do think a lot of these drugs get a bad rap because people that are using them don't know what they're doing, right? They just got on this train like, well, everyone's giving a dose, I'll just give whatever dose they feel is appropriate. And then if they have side effects, they don't know what to do. And I tell people this when I talk about thyroid hormone. When you give somebody thyroid hormone, if you don't also check their B levels and their D levels and their iodine and their ferritin and their reverse T3, you are wasting their time, because if they don't have the cofactors they need to make the thyroid hormone work, it's not going to work. And so, like, same thing with this, right? You have to go to a provider that understands, like, hey, there's more than one piece to the puzzle. And so to your point, I think a lot of these people who say they don't work. So if you're somebody listening to this and you're like, well, I've tried microdosing or whatever and it didn't work, my question to you is, first of all, even further back than that, did your provider even talk to you about sunlight, movement, nutrition, sleep, stress? If they didn't, run, right? Like, I mean, that's what kills me with people. Like, people tell me all the time, well, I go to this provider and they have me on 10 medications and I don't know what to do. And I'm like, well, did they talk to you about your diet? Did they talk to you about movement? No. I'm like, why are you still going to that provider? Like, I don't understand.
Well, I really wonder, to that point, something I say all the time is like, why are people wasting money on functional medicine doctors when they're not doing all those things first? Like, get those, I mean, from you and I to your audience, I know you feel the same way. Like, get those things handled first before you ever even walk into your door or my door, like, please get the basics handled, because if you're not doing any of that, none of this is going to work for very long anyway. Right. And we're just going to be chasing our tails. It's like trying to hit a moving target. Whereas somebody comes in and they say, oh, I'm strength training and I'm, I'm eating nutritionally dense food. I'm getting my circadian rhythm set and I've got my sleep dialed, or maybe my sleep's challenged because I'm in frickin' menopause, and maybe that's one of their chief complaints, but all in all, they're trying and they're doing a pretty damn good job. Then we just get a sprinkle on a little bit of this and that and things. Then it's like moving puzzle pieces around the table a little bit versus like trying to hit a moving target that we'll never get to. And then that patient ends up frustrated and they still choose to not do the work, right? It's the work that at the end of the day, it's the work. And the thing that I love about GLP-1s is, and I've been called elitist for this, but it's not. For those of us doing the work, a little tiny sprinkle of all of these things is so easy and simple. And it goes down the pathways we want it to go down, and everything's pretty easy. And we might run into some hair loss here or there if we're shoving, the pathway a little bit too much, and that patient's maybe needing a little bit more thyroid support or maybe some nutritional support. But we figure that out and we just move the puzzle pieces around the table, and eventually they all click together, versus somebody coming in that's entirely just an inflamed, pardon my French, but like just a shit show of health, right? Mm-hmm. And they want the microdose and they think it's going to do something. And I'm like, no, honey, this is not for you. Like, this is not going to work that way.
Yeah, if we're in a situation like the wildfires in LA, you can't just sprinkle a little helicopter water and expect things to calm down. Like, yes. No, yes. I completely agree. It's, and it's, to your point, the doctors have to know what's going on. And my favorite thing to say to patients too, you kind of made me think of this, is like, a lot of people are like, well, I eat organic. And I'm like, that's great. You're wasting your money eating organic if you're not, if your gut's a wreck, you're not sleeping, you're stressed out all the time, and you're not going outside walking or moving, but you're spending $400 a week at the grocery store on organic food. we need to redistribute our funds, right? Like, because
it's
food, you're just pooping it right out. If you're
it's
pooping, if you're
the
even pooping, like
the food discussion is so tricky because it's like you can't move the needle unless your diet's dialed in for the most part, right? You really can't. Like exercise is
right,
not going to induce weight loss. It's really what's at the end of your fork. But that said, all this hyper focus on food that we see all over the internet, that we are even seeing with the Maha movement, this hyper focus on food and artificial ingredients and all these things. I mean, that's all fine and good. But at the end of the day, I'm like, but you don't have any muscle mass. So
right.
like your $200 a day Erewhon grocery store habits while you have zero muscle mass and you're over there telling me how I should be eating or how like you're telling people on the internet how to eat. I'm like, honey, you can't do a push-up. Like we have a problem, so
Right.
it's hard. And I know it's really frustrating for probably your listeners and the people are probably mad at me by now and also the general public. The thing is that we have to do all the things. It doesn't matter how old we are, young we are, we have to do all the things. And I know that's a full-time job, but it really is living in this toxic cesspool that we call planet Earth. We really have to be doing all the things. And at the very minimum, strength training, walking, and eating nutritionally dense food, right? I mean, at the very minimum. And then if your sleep's a wreck, there's usually a reason, right? And we need to get to the bottom of that. That might be your adrenal function. That might be your sex hormones as you're approaching menopause or in perimenopause. Like we might need to do a little work there, but it's all so much easier to fix and fix up if the person's doing the work.
Yeah, no, I completely agree with all of that. And my listeners probably are sick of hearing me say that as well, but it's so true. Like I tell my patients all the time, like your health is not owned, it's rented, and rents due every single day. And I actually have that on my refrigerator at my house and at my office because I got really frustrated when my Hashis was all out of control in my early 30s. And I thought, like I do all these things all the time to stay healthy. And then, I want to take a month off and then, my health goes to shit and I don't feel good. And so I just got very frustrated. Like I shouldn't have to work this hard, but it's like, no, because your body is like it's a temple, but it's like a machine, right? And so like, if you don't give the machine what it needs, then it's not going to work. So it's not fair to say, I'm going to be really good to you for 11 months out of the year. And then 1 month, I'm just going to trash you completely, right? Like that's like, you don't fill your car up with gas or turn the engine off or, anything for a month. Like it just doesn't work like that. And so I try to remind people like health is not owned, it's rented and your rent's due every day. If you want to stay healthy, if you don't, then that's your own prerogative. But obviously, you're going to start having issues. So I completely agree with that. And, I think all of this I want to go back to muscle mass, but I kind of want to transition out of the microdose GLP-1 conversation. But I have one question that a ton of people were asking about, which is retatrutide. And so I've used it a little bit. I know you haven't used it a ton. You were telling me prior, but what I have seen, and I just want to put this out there, I have seen in true microdoses that it actually is more of like an anabolic type peptide, which is what I've heard other people say as well, meaning it will make you hungry, but if you're eating the right things like the protein and you're putting in the work and you're lifting weights, what happens is you actually gain muscle mass. And so I've had people who I put on it because they have cortisol issues because it's supposed to help with stress. But I do warn them, like, you may be hungry. You have to make sure you're eating the right things. I pick the people I put on it because I pick the people that I know are putting in the work and that can build muscle, because ultimately building muscle is better for you, right? But like myself, so I took a microdose of retatrutide, literally like 1 unit for 4 weeks. And last year I was trying to put on muscle. Like I was doing this whole program trying to build muscle, and I build like maybe 4 pounds in a year. It was kind of frustrating, but I was trying. I took retatrutide 1 unit for 4 weeks and I put on 3 pounds of muscle. It was wild.
That's
it was
wild.
so crazy. And I was hungry, but I was trying to eat more protein. But I just wondered, like, have you had any, like, what have you seen with retatrutide?
So it depends on the person. What I found with tirzepatide is that even in tiny, tiny doses, if somebody is quite lean and good body composition, really just using the peptide for other reasons, most notably women my age who are maybe starting, because women my age, even very lean, 6-pack abs, fitspo influencer kind of women, can have cardiovascular and blood sugar dysregulation start, right? You've seen it on labs. And as that estrogen wanes and as things start to shift or stress levels get high or all of the above. And so they will even take on tirzepatide a tiny dose and find their blood sugar about day 2 to 3 after their injection. Their blood sugar will
Interesting.
bottom out and it's horrible and it feels like you're dying. It's really not a pleasant experience. I've had it happen to me too many times. Your head gets this weird feeling and you feel like you're like, am I having an aneurysm? Like this is not a fun experience, but it's kind of like a void feeling. It's not a painful feeling. And I found that on retatrutide too. I think the triple agonist in there, I think we're pulling so many levers. And really, I'll tell you the truth. I use GLP-1s predominantly for my immune system modulation. I notice the inflammation, the edema in my face, my psoriasis, all of those things are so much better when I am using a GLP-1 than when I'm not. And even if I'm eating super clean and doing, I mean, I have had access to all the things for a long time. And I have been using things like low dose naltrexone for decades, like since 2008 when I got licensed. Nothing was working. And this is just this wonderful tool I have that just like whoop turns down the inflammation. I didn't find that impact to be as profound with retatrutide. So I like GLP-1s for their immunomodulation in particular. And so if I don't have that, and I really get that, I think most notably with tirzepatide, even over semaglutide. So I don't know. I think it's different strokes for different folks. Everybody feels different and has a different experience on them. But I feel like retatrutide is pulling too many levers in folks like myself who are really metabolically quite sound. I don't know. I maybe a higher dose, or some people are saying try a higher dose. I've seen that blast out people's metabolic health. Actually, an example would be I have a friend she's a competitor. She does like bikini competitions, so she's getting very, very lean. And then they're using retatrutide in between shows because they'll rebound back up. Their appetites might get a little bit out of control. And then they'll use retatrutide almost as an appetite suppressant and metabolism rebuilder from the damage of doing these shows and getting so lean. It's crazy. It's a crazy cycle these women and men put themselves through. I don't know though. I feel like a little too much of any of these peptides is a lot too much. And so really crashing out. I mean, she just went pale and gaunt and was disappearing in front of me. I was like, what are you doing? And then the bro science guys who are talking about microdosing, this is the funny part, is where they take a standard dose and then they just break it into tiny little daily doses. And they're calling that microdosing. And they're talking about retatrutide for that. And so I feel like the inmates are running the asylum and I haven't come to the right I haven't used it enough to have a good opinion on it yet, but that's been my experience, at least what I shared.
Yeah, I will say a lot of what I've heard on the internet about retatrutide have come from bodybuilders, different things like that. And I'm not discrediting those people. Like what they do to their body is wonderful. They are different than most people, right? They do different things to their body, their metabolism, just some of the things that they do change their body, right? And so they also a lot of times, not always, but a lot will have body image, maybe issues, different things like that. So I just, sometimes when I hear that, right, from like bodybuilders or whatever, do this, do that, I'm like, 99% of the population, that's not going to work for. Right. 99% of the population don't measure out every grain of rice that they eat, right? Like they don't. So you have to be careful with that for sure.
Yeah.
Okay. So I just wanted to know your thoughts on that. And so I agree with you. I think that with tirzepatide, in my experience with patients, tirzepatide, you get the most inflammatory benefit, the most immunomodulating benefit. And I'm like you, I tell my patients, I'm not giving you this for you to lose weight. And this is hard for people to hear. I'm not giving you this because I want you to, it's going to make you like lose weight. Do I want you to lose weight? Yes. But I want your body to heal itself. I want the environment that you live in to feel loved and well and nourished to the point that it starts to heal your body and you fix yourself. Like that's the point of our body. I think it's so true. Like your body is like an environment. And when your organs don't feel safe and like mature and like they can eat and they're just well in your body, then things are disarray and you're not going to lose weight. And so I use it for that inflammatory calming effect. And I do agree. I think that when you get on these higher doses, you just end up with issues. And so the people who want to push their doses higher and higher and higher, my question to those people are, what are we missing? Like, are you sleeping? What, what does your stress look like? Are you drinking? Like, why do we need to keep, are we using food to cope with something else? Like, why do we need to keep going up on this dose? Right. So I think those are all great, wonderful
Yeah.
points.
You can chew through it. You can totally chew through it or drink through it. I joke and say it's kind of like the fuck around and find out peptide, because it really inhibits your inflammation so much in most folks that they feel so great. And you're like, I can eat gluten again. I can have a couple
Uh-huh.
glasses of wine without
Mm-hmm.
looking terrible and feeling terrible the next day. That benefit will eventually wear off and you'll be right back where you were. And you're going to have to keep cranking up the dose into nausea, into stomach cramps to get the same impact. So you have to be doing all the other things in order to keep that dose as low as possible. It's a reward for doing good work. It's not a tool that you keep cranking up to mask shitty lifestyle.
That's actually a really good point. I've never thought about it like that, but I might start telling a few of my patients that. I like that. This isn't you can't just keep making really bad decisions and going up higher on your doses.
Well, I've done it. So I've done it. I'm like, why do I need a higher dose? Oh, because why is my
Yeah.
psoriasis coming back? Oh, because
Yeah.
Yeah.
Okay. So I kind of want to transition and talk to you about like perimenopause, menopause, because a lot of the people that listen to this are in this stage. And I kind of want to talk to you about a couple things. So one is estrogen. I feel like there's a lot of negativity about estrogen and progesterone out there. Some of it came from WHI. We've talked about this on this podcast in particular. Progestin is not the same thing as micronized progesterone. Hormone should be given at the right dose, the right frequency, the right duration, etc. But I want to kind of focus with you, since you're really passionate about metabolic health and gut health. I mean, tell people in your experience, is estrogen important and why, specifically for metabolic health, muscle mass, gut health, and the same thing with progesterone.
Yeah. So I have been prescribed. I didn't get the memo on the Women's Health Initiative, apparently, to be afraid of it, because my mentor at the time was like, "Oh, this is a garbage study. Don't worry about it. We're not using oral estrogens. We're not using progestins, so we're fine, right?" And so I continue to prescribe and live in my little bubble in Portland, Oregon, where I'm surrounded by naturopathic doctors, and all my patients have been just wonderful. And my mentor, was prescribing for women with a past history of breast cancer and other issues. And I say all that with the disclaimer of, I am not your doctor. I'm just sharing a story, and this is for educational purposes. But this idea that everything that we were hearing out there was pretty nonsensical for the last 2 decades when it came to hormones and HRT. So I was just hanging with my mentor and doing what we did. That said, I have found a need for progesterone in virtually almost every woman who's walked into my clinic, regardless of age. There's been a need for progesterone. And young women, we could often get away with a topical, depending on what they need it for. But, we could often get away with a topical progesterone if we were maybe needing to mitigate some PCOS symptomology or whatever. And then obviously there's a point where we want to go to a more oral form, especially if we're dealing with sleep issues, anxiety, what have you. We need more of a neuropeptide impact. We go to an oral micronized. And then as women needed estrogen, I would give estrogen. And I was a fan of topical creams. I will say my own personal experience, I completely changed my mind on that most recently. I'm a little bit ashamed to say how slow I was to the party on this. I was able to get what I needed done with topical estrogen. It was so much better when I put a patch on and got steady state estrogen in me. Like, it was so much better. So I just didn't realize I didn't know what I didn't know. And I also didn't appreciate the amount of horrific chronic pain that can come with waning estrogen. So I knew that testosterone was a player there. I knew that estrogen was indeed a player, but for some reason I didn't, of course, as we do, I didn't appreciate it as much as I do now until I lived it. Right. And so after going through like 2 years of crippling spinal pain to the point of, I did not want to get up. Right. I wanted to lay down all day. I was in so much pain, and then slapping a patch on, and then seeing how, as that I like to use the patch that lasts a week, and seeing how after, not even up to a week, all of a sudden, as that estrogen would start to get used up and wane out of the patch, the pain would come back. And seeing that cause and effect, that correlation, I was like, holy smokes, this is crazy, like how impactful that is. And I had many patients who experienced, they were good on their creams, but I'm thinking now in hindsight, maybe a patch would be a good idea. That whole impact on the pain side of things is crazy. And I don't think we fully understand it or appreciate it. But from what I've studied, I've read a lot about this. I have been treating patients in pain. My background's in regenerative medicine and regenerative injection therapies. And so I have been approaching women of middle age. And of course, that's predominantly who comes in is middle-aged folks, right? Men and women to a regenerative injection therapy practice. I have been approaching them with hormones first, with a hormone first, sort of that menopause, the musculoskeletal syndrome of menopause. I've known that for decades, and I've been treating that way for decades. Now the data is catching up with how I've been treating, right? And again, my mentor taught me that, Dr. Heidi Peterson. She taught me years ago, like put the progesterone and estrogen cream on the frozen shoulder, like actually treat topically, get the hormones in the system before you start throwing the injections at them, right? And calm down the system. And so that's how I've been doing it. But I think that now we have a new player as we bring in GLP-1s. And it's really important that we address the steady state estrogen because it's the fluctuations in the estrogen. It's the fluctuations up and down. It's the peaks and valleys, I believe, is what's driving that pain. It's not just the lack of, it's when we start to get these waves, right? And I think mamsy-pamsy smearing on your cream whenever you feel like it during the day, which is what I did, or when you remember, is a bit problematic now in hindsight. So I am a big fan of patches. I would love to hear what you have to say about that. And then I'm a big fan of utilizing GLP-1s in conjunction because I have found, and you're the endocrinologist, I'm sure you're, I bow down to your expertise far more than mine. But what I have always seen is this sort of, I like to use blood to test initially to get confirmation that we need it, just really to cover my butt, right? We got to cover our butts and make sure that we have objective data showing that and we have a symptom picture that adds up. So that seems not necessarily with progesterone, but definitely for estrogen and testosterone. And then I like to use a Dutch test on the tail end to see what pathways things are going down. And I have found that estrogen in a inflamed, metabolically compromised, excess adiposity woman tends to go not always the way we want to go. And so that has been a real problem and something that has frustrated me for a long time in practice. And I have found GLP-1s to be this beautiful tool that we can bring in to just clean up the milieu, and then we can apply the hormones and they are much more predictable. So I would love to hear what you have to say about that. And then as far as pain goes, it just goes hand in hand. I think most women in middle age do experience some level of pain. That is what I have seen clinically, and not just because that was the focus of my practice, but because most women in middle age, as that estrogen wanes, starts to experience more micro traumas to their tissues, more tears. We get tears at the enthesis, which is that that tendinous ligamentous junction where tendon and ligament meet bone, is called the enthesis. It's highly innervated. This is where the injections that I do in prolotherapy, that's really our focus. And that area freaking hurts when you tear it. And it's not something you're going to see on MRI. It's not something you're going to see on imaging. It's something you palpate. It's in the symptom picture. It's how they describe their pain. And that is, I believe, predominantly what most people are experiencing when they start to age, is we start to get these little microtraumas in the enthesis. And you're just going to tear to shit when your estrogen goes away. Like as your estrogen goes away, you just tear, you lose your juiciness and your elasticity. So what an absolute disaster that is. And then let's compound the issue with the fact that you're becoming metabolically compromised by default from aging. It's called inflammaging. It's what's happening as we age. You're losing your estrogen, which puts you into more of a metabolically compromised state. And you shift from a gynoid shape to an android shape. So you go from this nice curvy woman with hips and boobs to a little potato shape, android, more male shape, androgenic shape, which then further potentiates the metabolic dysfunction. And it's just an absolute disaster. And when you add that to the fact that elevated insulin, elevated leptin inside the joint actually causes further damage and compromise. It's basically osteoarthritis is, in my opinion, diabetes of the joint and lack of hormones. And it's just a shit show. And so I think that this is where GLP-1s are a beautiful place to interject. GLP-1s were the missing link in my practice for the last 20 years. Like when I finally figured out that I could use little tiny amounts to just sort of clean up shop and get done what I need to get done, it just miraculous.
Yeah, no, I completely agree. And to your point, like this, shit show that you start to go through menopause. I mean, it's true. And a lot of it, I think, is this lack of estrogen. And to your point, also the progesterone, I see so many young girls now. I do a lot of infertility stuff. Unfortunately, I see lots of infertility people who haven't had a proper thyroid workup. I'm sure you've
Yes.
heard that.
Amen. Yes.
Jesus. Yeah. I mean, literally, I saw a girl last week who's paid for 3 in vitro procedures, and her T3 level was 2.9 and her TSH was 3.5 and her progesterone was undetectable. And so I was just like, what? Anyways, so
Can I add something before you go on? This is what I have told my patients for a long time, for decades. In animal husbandry, if a dog, like if they're dog breeders that are breeding high-end dogs, if the dog can't get pregnant, the first thing they do is treat the thyroid, address the thyroid. And we, for some reason, as humans, do not do that. We put these poor women through these horrible, horrible experiences with drugs and hormones to try to get them pregnant. And I'm like, you just need a little thyroid. And you need to stay on the thyroid so you can maintain the pregnancy also, and the progesterone. Like,
and the progesterone.
yeah, right. They go off to their OBGYN. They say, oh, you're seeing a naturopathic doctor. You don't need that. You don't need any of this. And then I've unfortunately had patients lose the fetus. So anyway, just wanted to throw that in.
Yeah, I had one of those last week too. But yes, so to your point with progesterone, I tell everyone progesterone is like God's Xanax, right? It's like God's gift to women. And so if you are listening to this and you are not nice to people, especially during certain times of the month, I don't care how old you are. If you can't sleep, if you lose your mind over little things, you need to talk to somebody about some progesterone, possibly. Your husband will like you, or your significant other, and everyone you work with will like you.
And crying, yes, lots of crying. If you fall apart, seriously, that's like cardinal symptom. If you cry on the drop of a hat, progesterone.
Or the other big one I think is sleep. A lot of times people will, like when you go to a doctor and you're having issues sleeping, they'll blame your phone, or and a lot of times that is the case. Like if you're playing around on your phone, not seeing the sunlight, whatever, and you have issues with sleeping, maybe. But if somebody has issues with insomnia, like that's what kills me. These younger girls where you can see they're clearly having insomnia issues, their cortisol is high, their progesterone's low, their insulin's high. I mean, this has probably been going on for a while. Give them some progesterone. Like it's not going to hurt them, And so I love progesterone. I use a ton of it. I use it myself. My husband loves progesterone so much that he actually has progesterone in his bag when we travel, because I forgot it once and he was like, that's not going to happen again. So he's like, we must have Cassie's progesterone. No, I love progesterone. And the same thing with estrogen. I agree with you. I think that a lot of times people don't realize when they're losing estrogen, the symptoms that they have, to your point, the joint pain, there's nothing worse than you being in pain. And I'm sure you can relate to this. Everything hurts. Like you were talking about your chronic back pain. And then you start gaining weight and not feeling good. And then you need to get up and move and exercise or do whatever, but it's like you're in pain. And that's just like, I think that's the problem with aging, is like one thing starts and then it's the next thing and it's the next thing. And people are like, anything that's difficult, people don't want to do, right? Like the harder it is, the more we don't want to do it. And that's just human nature. Like we're wired to not want to be in pain and not do things that hurt us or are hard. And so I think that's the problem with estrogen, is like the slippery slope with women. And the other problem, I think, I tell women this all the time, women do not pay attention to their own bodies. Like how many people listening to this right now have taken 2 minutes today to stop and say, check in with themselves. I call it tea time, right? Like, hey, Cassie, how are you feeling today? Did you take your supplements? Are you in any pain? Did you get enough water? Do you feel like you slept well last night? Are you hungry? Like, how's your headspace? Have you been outside? You know what I mean? Like, people don't do that. Especially women, we don't do that, right?
Yeah,
and so if you
true.
don't do that ever, then it's like one day you wake up 10 months from when you thought you started feeling bad, and it's like really bad, right? Because you haven't been paying attention. You haven't been listening to yourself. And so I tell people all the time, like, if you listen to your body when it whispers to you, then you don't have to deal with the shit when it starts screaming, right? Like, because it's bad when it starts screaming. And so
I didn't mean to interrupt you. I'm sorry.
No. And so I think that's part of the problem too with estrogen, is like, it's like this slippery slope. Like as you lose it, your level's 100 one month, and then the next month it's 95. And then the next month it might be 80. And so it's like this progressive loss. And by the time you put it all together, it's just really bad. And women just don't listen to themselves.
Well, the terrible part is you feel like the carpet got pulled out from underneath you, and you end up often with a very flat affect coupled with crippling anxiety and mood swings. And so you're almost unable to hear your body. It's a very weird detachment. What they did a study, I need to find it. I read this last year and I was like, yep. They took mice and they cut out their ovaries, and the mice went in the corner and got fat and quit moving. I
Yeah,
mean, I was like, yeah, that's it. And
sounds right.
I was just perimenopausal. Like I wasn't even I'm still cycling regularly. I share that because I want women to understand this all can be happening in real time over a period of time, sometimes an extended period of time, years, where you are going through this and you're not even in menopause. And poor women are my whole generation got completely screwed over by that Women's Health Initiative study, a whole generation without hormones. It's really devastating to me. And the generation above me. The terrible part is though, is you don't even know it's happening. It's like you have an 8-cylinder engine and you're only firing on 2, so you can't see it in front of you. It's your husband has progesterone. I told my husband he's got a book with all the passwords, all his passwords, because he's very disorganized. And so it's like the book, we call it the book. And I told him to put in there, like, these are the 3 things to tell me to do when I'm not making any sense.
Yeah.
So did I take
My
my
estrogen.
thyroid? Am I taking my thyroid? Yes. Where's my progesterone? And do I need to change my patch? Like those are the like 3-step process if I'm not making sense, because you just can't always see it. And I'm with you. I'm very in tune with my body. I find through the work that I've done in regenerative medicine that a lot of people are not. And as women start to feel like they're living in this alien body, that the brain isn't working, the body isn't what you don't see yourself in the mirror anymore. You don't look right. Your body is changing. Everything is just like, fuck, like what is happening to me? You start to detach, especially if there's pain. You really do start to emotionally detach from your body. And that's where physicality, physical fitness, strength training, doing hard things, like that's the one way to really stay in your body. And sex. I mean, those are 2 great ways to really stay in your body. But as those changes are happening, you don't feel sexy. You don't know where your brain is. If you're type A, like you and I, like high, we're boss babes, all of a sudden our brain power's gone and we're driving our team members crazy because we can't remember what we just did with our car keys. It's bad. And I really want women to understand, start sooner than later. Get on this before you think you need it. Find a doctor like Dr. Cassie here before you think you need it, because this is not going to get better. It's a slippery slope and you don't always identify that it's happening.
Yeah. And to your point, you're still cycling. I tell people this all the time. They come to me. I saw a lady today and she's like, well, my gynecologist said I can't take estrogen because I still have periods. And I said, well, congratulations. Your FSH is 30. Your estrogen is 18. You're 45. You have dry skin. You have vaginal dryness. You have, hot flashes, every symptom of menopause. You can take some estrogen. Like your ovaries are trying, and so to your point, and I do, so I use estrogen cream. I use patches. I use estrogen. I do not like oral estrogen, but I do. I mean, patches are fine. Creams are fine. I tell people, I want to give you whatever you'll take to get your levels where they need to be and keep them sustained and get rid of your symptoms. Like that's what I'm looking for, is your symptoms to be gone and your levels to be high enough in your blood where I know it's protecting your heart, your brain, your bones, your breast, everything I need it to protect. In addition to that, I completely agree with you with Dutch testing. So we do Dutch testing and I see astronomical amounts of estrone being made, the 16-hydroxy pathway, when you start someone on estrogen. And it's kind of my rule, and again, I'm not your doctor either. I give hundreds of women who have had breast cancer estrogen because I'm very comfortable doing that, because I will tell them, when I give you this estrogen, I'm going to look at your pathways. And if you're making estrone, we're going to fix it, because you're more likely, based on studies, to develop recurrent breast cancer and have mortality increases if you don't take estrogen after cancer than if you do. And so I'm highly comfortable with that. I have family members I've done that with that have had breast cancer, and I have put them on estrogen. And then I see how it metabolizes, because it's, to your point, you can shunt it down the correct pathway and then people do so well. And so I like that you said that and you brought that up about Dutch testing. I've had patients come in and they're like, oh, my oncologist, my primary care doctor says you're trying to kill me. And I'm like, really? We'll take them this Dutch test back and show them that you're making 100% estradiol for the most part and you're not making estrone. And then you go ask them how likely you are to have a heart attack and die, because 2 out of 3 women that are postmenopausal die of heart disease, versus that like 1 to 2% that you're going to get recurrent breast cancer. I'm taking the estrogen, you know?
Amen.
So it's
Amen.
frustrating, right? Like, cause that's what, I mean, we do that too. And then, oh, they come back and by the way, they're like, oh yeah, and my skin's not dry and I don't have brain fog and I feel really good and I'm sleeping and I don't hate my husband. I'm like, yeah, exactly. You know? And oh, by the way, that's protecting your heart and it's doing lots of things you don't even realize it's doing. And to that point, I want to talk to you about gut too. And that's the one thing I don't think people understand, which also frustrates me. Like you said, we get this changed shape as we get older, right? And we, you know, make this pear, make this potato, whatever you want to call it. Potato.
It's a potato shape.
Yes. And a lot of times when you talk to women, they also have bloating, right? They'll have like, oh, I feel really bloated. I have acid reflux. It doesn't matter what I eat. And a lot of those women, estrogen is affecting their gut. Like the lack of estrogen is affecting their gut so significantly. It's destroyed their estrobolome. They're not able to, you know, they're recirculating toxins. It's a nightmare. And then estrogen actually affects the peristalsis, or the movement of your gut. So these women are constipated, and then they have this bad bacteria setting there that's releasing bad things called LPS, which are, you know, bacteria in these bacteria. It's kind of like in bacteria, for the people that are listening, bacteria have something called LPS and they release it. It's kind of like a toxin. So it causes a lot of inflammation and it makes the gut lining, your GI tract, swell and then break apart. And then food leaves your gut lining and goes into your bloodstream, and your bloodstream doesn't know what all this crap is in your blood. So then you develop these immune complexes, something called interleukin 6 and tissue necrosis factor alpha. They all go up. And so then your body thinks it's being attacked, like it's under war. And so then your cortisol goes up and your insulin goes up, and then that makes sure, you know, you gain weight and your estrogen goes down and your progesterone. This happens every time you eat, every single time you eat. And so, and when you're not digesting your food and you're not pooping regularly, this makes it worse. And a lot of this is strictly driven by estrogen. So I have women who, we do a lot of GI maps. I do a ton of them. I reviewed 3 of them today. And I'll have people say, well, I don't understand, Dr. Cassie, I eat really good. Like, how do I have all these issues? I'm like, well, sister, you have no estrogen and you have no testosterone and you have no thyroid. So your gut's on vacation. Everything you're eating is just sitting there. And it's just, you know, wreaking havoc in this playground that we call your stomach instead of being excreted, you know? And so you can't just leave your trash. Like, it would be like you never take your trash out, right? If you never take your trash out of your house is going to start smelling really bad and you're going to have an overgrowth of things you don't want there. And so you have to poop every day.
Yes. I got to poop every day.
Usually more than once a day. Like most people, if you're eating 3 meals a day, you should be going to the bathroom. And if you're not, that's a problem. And a lot of times that's hormone driven. And we just completely miss this, right? Like totally miss it. And so that's part of the reason I think people develop this pear shape too, is because they have such bad, I mean, I have seen, Dr. Tyna, some of the nastiest guts you have ever seen in 50 something year old women who eat, you know, only organic food from, you know, Whole Foods and do Pilates every day. I'm like, I don't know what to tell you. Your gut is not happy. It's like a trash ground in there, you know, like we've got to get your hormones fixed.
It's so sad too when these women think that, you know, they're trying so hard. They really are. I mean, they're way more diligent about it than even I am. And they're doing carnivore or they're doing keto and they're just getting worse and they're gaining weight and they're getting worse and they're gaining weight. And I'm like, you are in a situation where that high arachidonic acid, that high LPS is actually inducing further metabolic disruption and devastation. You're in this feed forward trap and you got to put some vegetables back in, or you know, we got to work around, we got to put some carbs back in the ship. And they just won't hear it. They're like, but carnivore, and you know, Dr. So-and-so said, and I'm like, yeah, well, high fat, high animal fat, high arachidonic acid is not always the panacea. And just for the reason you said, if we add some estrogen in, we can start to see some improvement. And once you take that android shape, you are sort of feed forwarding the metabolic dysfunction, which is further destroying your gut health. And it's just a really messy, terrible place to be. And slap an estrogen patch on and clean it up. That's
Your thyroid. And yeah. And to my, I have people who say that to me all the time too. Like, well, I've eaten carnivore forever, or, carbs are bad. And you've been doing it for 3 years and it hasn't gotten better. So maybe we should try something different,
yeah.
like everything has to work together. And so I think that's another huge misnomer to women. Like, if you are having issues and your hormones are changing, not everyone gets hot flashes. There are lucky people who just go right through menopause and never have a hot flash. God bless you people. But like, there are people that happens, but everyone's symptoms are different too. And so I think that's part of the problem. Like, if you don't have hot flashes, but maybe you have dry skin, or you don't have dry skin or hot flashes, but you have severe vaginal dryness and UTIs, or you have that and you're having gut issues, like everyone's going to have different symptoms. And so finding somebody who helps you understand that and can help you fix that is really important. And to your point, like, there are people who are trying so hard, but they're listening to people online, people without credentials, people that are just making stuff up, people that, maybe one thing worked for them, and so they're just toting that. Everyone is like an N of one. I tell my patients, you are an N of one. Like, you are like no other creature on this planet. And just because something worked for them doesn't mean it's going to work for you. And so to your point, we have to move all the puzzle pieces around and figure out how to fix it. And I think that a lot of women have this huge disservice of, not wanting, we can't put you on estrogen because fill in the blank. And I will go on record saying there is not a single contraindication to estrogen in the world, other than if you have seizures. And even if you have seizures, you can do a patch, to your point. You can do a cream. You just don't want to do an injection or a pellet, something that you can't take the estrogen back.
Yeah.
But other than that, there is zero contraindication to estrogen. I don't care what anyone says, except for seizures. It will lower your seizure threshold. But again, if you've got a patch on, you just take the patch off if they have seizure, right? So there's no contraindication to it, but there's so many benefits, and there's just so many people who have been disserviced because doctors are idiots. A lot of doctors are idiots. Not all of them, but a lot of them are idiots.
I'm not going to argue.
They're not idiots. They just don't read literature correctly, right? Like, they hear something, they take that, they go with it, right? And they don't like look for themselves or look for answers, or that's what I meant. I didn't mean they were all idiots. That's what I meant.
Oh, no, it's fair. I don't disagree with you completely. There's a lot of mediocre doctors who do mediocre work. That's how I describe it. And they don't want it to go that extra mile, because that's a lot of work. It's hard. If they were to actually hear what we were saying and have to learn all of this themselves, it would be a tremendous undertaking. And so it's easier just to shit all over what we're saying than it is to actually go change up their paradigm.
Yeah. It's much easier to write a prescription and shut someone up and like walk out the door than it is to actually listen and figure out what's causing their symptoms and how do you fix it.
Yeah. And that takes a lot of extra education on their part, right? The interesting part is that the estrogen, I mean, I'm always a big fan of like, can I get the patient's instincts to turn on? And I feel like estrogen is one of those things that gives you that really beautiful feeling like you're floating on clouds, kind of calm. I mean, it really just sucks the anxiety right out of the air. It helps alleviate. For me, I mean, my big symptoms were really flat affect and depression. And I was like getting my teenage depression back. I was a pretty depressed teen. And I was like, what is happening? Why is this happening as I approach 50? It was lack of estrogen. And when that estrogen's back on board, you start to make good decisions again. Everything makes sense. So you make better decisions about the food you put in your mouth. You make better decisions. You want to move again. You want to have sex again. You want to do all the things. You want to be out and you want to be social. You want to find community. You want to be a better person and really dive into your purpose. Like, those are all the things that lack of estrogen take away from you. And so I'm just a big fan of giving women their life back in that regard. It's really unfair that they are not being given the opportunity. And it's really terrible when we wait until hot flashes. Hot flashes are so, so bad. Hot flashes are the harbinger of doom. I don't get hot flashes, but man, if you're getting hot flashes, especially frequently, there's like a whole litany, a laundry list we could go through of what that means, and that the harbinger of doom. And it's bad. It's all bad. And so I look at hot flashes as a spasm of the cardiovascular system that's happening body wide. That's bad news. So those women, like, get the estrogen on board ASAP, because that's nothing to mess around with. That's not something you want to wait and see if it gets better. It's not going to get better.
Yeah, I like that. A spasm of the cardiovascular system. That's like a slap in the face. Like, figure it
That's
out.
pretty much what it is,
Your
right?
body is like, hello. Yeah,
Well,
pay
we get
attention.
that's what migraines
Yeah.
are. When people
Yeah.
are, experiencing frequent migraines, I'm like, your cardiovascular system is spasming, and that's happening body wide. We do not want that. That's not good
No.
news for anybody with their cardiovascular health. I have a question for you. What
Yeah.
is some of your favorite tools that are, I mean, aside from probably some specialty supplements, how do you like to tell women to get them off of that estrone pathway and get down into estradiol? Because that estrone, just for the women listening, like that is where your fat makes your estrone. So when your ovaries go offline, if your adrenals are crapped out from chronic stress, like so many of us, then your fat is what makes your estrone. And that's what doctors, I hate to say it, it's usually men are like, oh, you'll be fine through menopause because you have fat and that's your
Yeah.
estrone. But we don't want that. Estrone's bad news. So how do we divert that?
Yeah, I tell patients this all the time. So you want your estrogen to be estradiol, right? Ideally, good, happy estrogen. Estradiol is, the reason this is how I explain to women. It's impossible for estrogen to cause breast cancer when you have estradiol because there's two receptors in your breast, an alpha and a beta receptor, and estradiol affects your alpha and beta equally. So you're not going to increase the risk of breast cancer. Estrone is this really bad estrogen that's made in fat tissue. And so our testosterone is converted to something called estrone in our fat cells. I think of it as like a mechanism for fat because it doesn't want to die. Testosterone will over time kill fat cells, right? And it will develop muscle. And so our fat cells have made this way of not dying by converting that testosterone that would kill it into a bad estrogen. That bad estrogen, that estrone, has a 5 times affinity for the alpha receptor in your breast, and alpha receptors, estrone or estradiol alpha receptors in your breast are what increase something called BCL2, which is basically food for cancer. And so when you have a lot of alpha receptors stimulated in your breast and a lot of BCL2, if a cell in your breast mutates on accident or whatever, it actually has food to continue to mutate, and that's how we develop cancer. So the more estrone you have, the more likely you are to get cancer. That's just factual. And why traditional oncologists do not check estrone levels in women when they are diagnosed after they are treated at any point in breast cancer has blown my mind for a really long time and frustrated me, but it's a level you can check very easily in your blood. So if you are somebody who is shunting all your estrogen down this 16-hydroxy pathway instead of down a good pathway and you're making estrone, what I talk to patients about, yes, is supplementation. So we talk about things like DIM that help stop that conversion, but we also talk about stress. So I do think that chronic stress, that elevated cortisol, pushes it down the wrong pathway. So we talk about the things we were talking about. This is why I ask people, what do you do for a living? Do you feel chronically stressed? Do you wake up in the middle of the night thinking about things? How's your sleep? Do you see the sun? What do you eat? So we talk about that. And then the other thing I like to talk to people about is like, what are ways that we can mitigate this fat tissue, right? So we need to get rid of some of this fat tissue. And then depending on, with the Dutch test, their organic acids and a bunch of other things we're looking at, we can find ways to change that estrogen. And so, I mean, what are some other things you do?
Well, I like GLP-1s to get the fat off.
That's
true.
that's get rid of the fat.
That beautiful. And there's other. I mean, we can bring in like, ipamorelin. Well, I'm sure you've got a whole litany of tools.
Yeah.
I
ipamorelin.
Get the fat off, and then we can start to have things go down the right pathway, and things are just much prettier. It's just much nicer. It's just a much better future for everyone. And
I like to focus on the sleep too and the fat, like you said. So ipamorelin, CJC, wonderful for people going through menopause too. Like, wonderful. Like if you're having a really hard time sleeping, I saw a lady today who was literally getting like 25 minutes of REM sleep a night. It was awful. She saw me, her gynecologist wouldn't give her hormones. We gave her hormones. I gave her estrogen, I gave her progesterone, I gave her testosterone, and I gave her CJC ipamorelin 3 months ago. And I literally saw her today and she had lost 10 pounds. She looked 10 years younger, and she was like, look, and she's getting like 2 hours of REM sleep a night. And she's like, I'm not waking up for like 7 hours. And I was like, perfect. So you've got to get these people to sleep. I think that helps a ton too, right? And just giving them the things that they need. And she was actually microdosing semaglutide too. So
yeah. I have found the GLP-1s can induce some insomnia, which is a bummer. Have you seen that at all?
I haven't directly correlated that, but I'm really I don't know. We work a lot with sleep. So people who are having issues sleeping, a lot of times have already had it. I haven't put that directly together. What do you mean, like REM sleep, waking up, not being able to fall asleep? What are you seeing?
Waking up in the middle of the night. But I also think that those women probably need estrogen.
Yeah.
So, yeah.
Or progesterone or
Yeah,
both.
both. Yeah, both.
Or both.
I mean,
Yeah.
yeah, the combo is very nice. It's
Or
like,
here's the other thing that I have found, actually, to your point, thinking about that. If you are on GLP-1 microdosing as a woman and you're waking up in the middle of the night, the first thing I ask those women, do you drink alcohol? Because
oh
you do
yeah.
get a hypoglycemic effect that I've seen with continuous glucose monitors, especially with alcohol and GLP-1s. You're going to get it with alcohol anyways. I think it's worse with GLP-1s. So a lot of times what I have found are the people who wake up at 3 o'clock in the morning, if it's not because they have to go pee, it's because their blood sugar is low. So I've put
Yeah.
CGMs on them and their blood sugar will get really low. And a lot of times the night they're waking up is the night they might have had a cocktail with dinner, or they had, wine, or they had, so that's one thing that I do see as well, actually.
Yeah,
So
alcohol and middle-aged women are not friends. It's too bad. It's just not a good fit.
So that actually that is a perfect segue into the next question I wanted to ask you, which was, I follow you on social media, and if you guys don't follow Dr. Tyna, you need to. She has great stuff. But I saw your what's in and what's out for 2025, and so I had to ask you, one of your outs for 2025 was alcohol.
Yeah.
And I tell people this all the time. I truly think in 10 years from now, Dr. Tyna, alcohol is going to be like tobacco. It's going to be like, why did we think it was okay for so long? And you see it in younger people right now, which I think is really cool. A lot of the 20-year-olds, like I was at dinner on Saturday night, my husband and I, and there were this group of 20-year-olds sitting next to us. And I heard all of them ordering mocktails. And I heard one of them say to the other one, yeah, I just don't understand why older people drink alcohol. It's so silly. You can have fun drinks that don't have alcohol. And I was like, yes, we have this younger
Yes.
generation of people who are actually intelligent. But what are your, like, why is alcohol out in 2025? And what is your kind of stance on alcohol?
I love alcohol. I love drinking. I love drinking. I love, and I'm a lightweight. So I only need a couple, like a glass of wine, maybe 2 glasses of wine. I have a fun little buzz. I feel great. I love having just one glass of wine with dinner, one glass, I'm not a heavy drinker by any means. I have never been a heavy drinker, have been a very consistent drinker. And I just realized, I'll tell you the truth. I've been on all these podcasts lately, right? And I've been flying around. Like right now, I can control the lighting, I can control the camera angle, but a lot of these podcasts, these dudes host, they do this overhead lighting. And overhead lighting is not a middle-aged woman's friend by any means.
Mhm.
And I just was tired of looking at these videos after the fact and thinking how ugly I looked. I just looked like shit in them. And I knew why. It was not that I am ugly or that I think I'm an ugly person. It was that my face was swollen and lumpy, and it was from alcohol. And even just the littlest bit of alcohol. I have the homozygous MTHFR mutation. I cannot metabolize or detox anything. And what the hell am I doing drinking alcohol? Like, right? Like, what am I doing? And if you know who Elle Macpherson is, she was the super, okay, like of my generation. I know you're, not the super young, but I know we're of different generations. Elle Macpherson was like the body, like
Yeah.
she was the beauty and the fit. She was fit, she was tan in this like world of Kate Moss skinny girls. Like Elle Macpherson was very lean, but also very fit and tan and lots of vitality. And she quit drinking. Well, she got breast cancer and she quit drinking. And she said, it's not how much you're drinking, because I never drank a lot. It's why you're drinking. And I was like, oh God,
Yeah.
there it is. Why am I drinking? So I asked myself that. And I was drinking to numb emotions and numb feelings. And I just think with the current state of the world right now, we got to be all hands on deck. Like, I don't know what kind of fuckery is going on, but I mean, I'm pretty excited. I'm pretty excited about this new administration. I will admit, like, I'm excited. I'm a pretty firm libertarian, but I'm pretty excited that like we get freedom of speech back and, maybe not get thrown in the gulags for talking about things that we care about on Instagram. But I also just don't trust like that anybody's going to come save us. You know, there's nobody going to be appointed. There's no Maha like saving us. We have to save ourselves. And so I can't really be doing that and consuming alcohol. So I just decided in one fell swoop. I honestly, this is the first time I've talked about it. I'm really mad at myself for all the years I poisoned myself with it. And I'm chasing these symptoms around with peptides. And I mean, I've had access to the best, I've had access for decades to the coolest, most advanced things in regenerative medicine that the world has to offer. And I mean, aside from going to Germany and getting stuff that's not legal in the US, and I am sitting here like pouring poison on it. It's like pouring lighter fluid on a fire and wondering why the fire doesn't go out, right? So that to me was just like, I'm just tired of looking like shit. I just want to be pretty. I know I'm a pretty person. I'm not trying to be vain. Like, I think we're all pretty people. But, you know, I want to see myself in the mirror. I want to look in the mirror and be like, oh, there's Tina, you know, not like some weird kind of swollen version of myself. So, and I'd like my brain to work because that doesn't, I mean, even with the hormone replacement therapy, like your brain, if you don't take care of it and you poison it for a long portion of your life, you will have problems. So I would like my brain to be in top shape.
I completely agree. I could not agree more with everything that you said. I think that a lot of people drink. So I drank a lot in my 20s and 30s. Plenty. And when I really, you know, I have a good friend who a couple of years ago stopped drinking and I was like, what is wrong with you? And she said, you know, when I really asked myself why I was drinking, it was to numb feelings. Yeah. And I thought, okay, well, that's weird, whatever. But then as I've gotten older, my problem more so was the way I metabolize it. So I have MTHFR as well. And it didn't matter whether I had a half a glass of wine, a whole glass of wine, a vodka, or a whole bottle, I still wake up and feel like I had a whole bottle. Like I just feel like shit. And
I'm dying.
Like, you know, and I have dark circles naturally anyways, like I have staining under my eyes. It's a whole thing. It's genetic, but like, and so I look sort of tired anyways, just naturally, even when I'm greatly rested. And then when you put alcohol on top of that, it's just like, yeah, you look awful. And to your point, it's like, why am I drinking? Well, a lot of times it was because other people were drinking. So I didn't want to feel awkward. Well, I'm too old to give a shit what anyone cares anymore or thinks about me anymore. And then the other reason was, yes, it was like to numb whatever was going on. And it's like, if you numb it, which is what I did for a really long time, when you wake up, it's still there. And when you numb it long enough and wake up, then there's more things there. And then it's just a bigger problem. So you might as well just put on your big girl panties and figure it out, right?
Yeah, suck it up.
Yeah. So to your point, like, that's what I told my husband. Like in the last 2 years, we do not drink very much at all. Actually, we probably have 100 bottles of wine downstairs that we've been trying to give away for years. We very rarely drink, but I told him, actually, it was funny. I saw your post the day before I saw your post. We decided we were going to do dry January. And then I told him, I was like, I think I'm just not going to drink anymore this year. And he was like, okay. And so
let's do it.
Yeah. I mean, and he's my husband's great. He's very supportive, whatever I want to do, you know, we get on whatever, he'll do it. But I think that people really need to ask themselves when they're drinking alcohol, why am I doing this? You know, because I don't know a single person that drinks alcohol and says, I feel wonderful the next day. So like, why are you doing it? It costs a lot of money. It's toxic to your body. You know, it just, anyways, we do it because I think, you know, the industry wants you to do it, right? They make it look cool. There's these fun, you know, looking drinks, whatever. Well, of course they want you to do it because it's beneficial to them, just like the tobacco industry, right? So I just wanted your take. It was
a thing. Like, I think it was a thing for us, right? Our generation. I mean, my generation drank a lot. We drank a lot. Like I lived in Oregon. Kids here drank a lot. Before that, I lived in Southern California. Kids there drank a lot. Like, I just think our generation drinks a lot and it's just not pretty. I'll tell you the other thing. When I smoked like a chimney when I was young, from 14 to 24, I smoked a pack of cigarettes a day. I cannot believe it. And I remember driving down the road and seeing this old lady pull up next to me. I was living in San Diego at the time, and she's got a cigarette and she's sucking off her cigarette. And I thought, you know, I was in my early 20s and I was just considering that maybe I think I had found like a gray hair, you know, I was like realizing I was not immortal. And I looked at her and I thought, I cannot think of a beautiful woman who's older, who smokes. Like, I couldn't think of an actress. I couldn't think of anybody who you just can't get away with that. If you keep smoking, it's going to be evident that you're a smoker, right? At some point. And so I decided to quit smoking. And then same thing with alcohol. The other day, I was like, well, I guess the other month, I was like, I don't know a single woman of my cohort, of my age cohort, of my level of success, honestly, like of my circle of women who I hang out with who are very successful and who are doing really cool shit in the world and really having a big impact on a big scale. I don't know any of them who drink much, if at all. And I
Right.
thought, well, that's it. And that they're all so beautiful, you know, the ones who like the JJ Virgins of the world who've aged so well. Like they're just you might see her with a glass of wine, but she nurses it all night long. You know, they're
Mhm.
just not drinkers. And I'm a drinker. Like it's like Kool-Aid. If you put it in front of me, I will just keep drinking it. And then I feel horrific and I feel like I'm going to die the whole next day, if not 2 days. And then it totally destroys my productivity for the next several days. Even if it's not a hangover, I have tremendous brain fog and I cannot do the cool shit in the world that I want to do. And I feel like after turning 50, time is definitely limited. I have more years behind me than I do in front of me. I feel that. And I have some cool shit I got to get done. And I can't do it if I'm hungover. So that was it.
I love it. That's what I'm gonna go tell my husband. I have some cool shit I need to do this year. No alcohol. It's out. It is on the out list. Out. Okay.
Yep.
So I love that. And I do think that's a very good point. If you're drinking alcohol and you have if you are somebody listening to this and you think, oh my God, I could never stop drinking alcohol, they're crazy. First of all, you've probably got a problem, right? But then if you're somebody
Sure.
who's like, well, maybe I could do it, then the question should be, why do I drink? And then figure it out. Like you do you. We're not, Dr. Tina and I aren't trying to tell you what to do. You do you. But I agree. If you want to do some really cool shit, that's not the way to do it.
Yep.
And then the last question I want to ask you. So what are three of your biggest wins for 2024? Because I also saw, and one of my biggest wins of 2024 was, I don't know if you know Coach Michael Burt. I met him. I went to a coaching thing that he did. And he said something that literally put my jaw on the floor. Like you have these moments in life where you're like, huh. And he was talking about type A entrepreneurs and how we're so hard on ourselves and how we are mean to ourselves and how, we don't treat ourselves like we would treat friends. All true. I know all this. I was like, whatever, just keep going. But he said to me, the problem with most people and especially entrepreneurs are that they are always living in the gap instead of the gain. And I was like, huh. And he was like, you're always living for the next thing, the next thing, the next thing. And you never sit and truly reflect on all of the gain. And when you change that perspective and you start living in the gain instead of the gap, your life will be different. And I was like, okay. And so gratitude, I've always somewhat practiced, but I like from that day, I was like, okay, I'm going to make sure that I pick a win every day. And before my head hits the pillow, no matter how bad, and I've had a couple of really bad days in 2024. We all do, but like pretty bad. And I remember one night I laid there and I thought there wasn't a single thing today that went right. And then I was like, nope, Cassie, that is not, we're not playing that game. We're going to pick one, right? You're breathing. There's one.
Yes.
So I think that when I saw that, I really liked that. Like, what are your big wins? And so I've really focused on that last year and this year too, like live in the gain and not in the gap. And so I want to know, what are three of your biggest wins for 2024?
Well, I will say, honestly, I'm writing down live in the gain and not in the gap. It's so cheesy, but it's true. Getting this hormonal situation sorted out, because something that was happening to me was, for a few years, I was chronically getting injured and I was making no gains in the gym because I just kept injuring myself, and I couldn't sort it out. I was doing all the things. I was consulting with all the people. It just was not getting sorted out. I have psoriatic arthritis, so that, was contributing. But you tear your enthesis when you have psoriatic arthritis. That's where it attacks you. It's terrible. But I was also just not elastic. And so I finally gave myself permission in 2024. I was like, you know what? You're going to stop training so hard. You're going to stop going for really just stop going for goals in the gym, period. Just get to the gym, just get there and do your little grandma strength training and relax and just relax into it and let your body heal. And so for all of 2024, I did lose a lot of muscle. I did lose a lot of my shape. I did get some fat on me in places that I'm not super happy about, but I just let my body rest and heal. And now I'm back in the gym and my pain is tremendously managed, and I am so happy about that. Like it really took me a good year of not beating the hell out of myself in the gym. I had to stop PRing, I had to stop all of that nonsense and just accept where I was at and let my body heal and know that I was on the right path. So that was a big one. I'm very proud of myself for doing that because I'm very type A and I'm very goal oriented. So I think the other one was I went back out in the world. Like I had been really isolated through COVID because I pushed back very hard on the narrative, and I lost a ton of friends and colleagues and along the way. And I got in this really messed up headspace where I just thought everybody was out to get me. I really did, because I was so battered. Like I really do have such tremendous PTSD from those years. And it was something. I mean, I yesterday had a big sob session when I saw Trump sign the executive order to overturn censorship and make it illegal. I cried because I thought, God, to be on the receiving end of that, like full force with a big platform, was something to experience and was not fun, and it messed me up. So I went back out in the world, and I did so by going on podcasts, but I was just so happy to like connect to people, make friends like you, like meet cool people, and not only be seen. I mean, that's exciting to have your voice out there and be seen. It comes with some drawbacks because I'm kind of a hermit, but to like connect with humans again, just not hide on my farm. I live on a farm and I talk to my dogs all day. So I was like, oh, I made friends. So I made a lot of great friends in 2024, which I'm very proud of. And then I think the last thing is just having, there's just an acceptance of, realizing what you can and can't do and not fighting so hard against the things you can't change, and just falling into, maybe that just comes with age, but falling into a calmer place of like, there is some fuckery going on that I can't have any control over, and it's not my circus and it's not my monkeys, and I'm not going to engage in it. So learning to be more strategic and picking my battles, or not, or just not giving a shit.
Okay. No, I love that. That's one of my goals for 2025. And to that point, have you read the book Let Them by Mel Robbins?
No, but
You
I purchased it and I
you
have
need to
heard her
get it.
speak on it. Yeah.
You
Yeah.
need to
Yeah.
get it. And that
That's
whole
it.
fuckery that you're talking about, it makes you feel a lot better about that. So I love those. I think those are awesome gains. And I think that anyone listening to this, you should, and I did a whole episode about this, you should always look for your gains and you should write them down. And because it makes you feel good, right? Like you just lived in the gain and not the gap. And so everyone listening to this, I would encourage you, find 3 wins from 2024, write them down, and then maybe even think of 1 win from 2025 you've already had. So I'm going to give Dr. Tyna hers, and that is that she's done with alcohol. That's her win for 2025. At least for now, she figured out why she doesn't need it or why she doesn't want to use it. And so that's a win for her. Whether she does it for the rest of the year or not, she took it upon herself to say, hey, you know what? I'm drowning my feelings with it and I don't want to do it. That's a huge win. So she's already got one. And so, I would encourage you guys, if you're listening to this, to do that. So thank you for sharing that with us.
Yes.
I have 3 questions really fast. I ask every guest at the end of my podcast. Simple. Don't overthink it. People love this. Like, they love this. What is one food that's most beneficial and why?
Beef.
Okay.
It's packed full of really highly absorbable nutrients. It's such an easy, wonderful food it just will change the game if you can bring more high quality beef into your life. I think most women undereat it, and just give yourself not like you don't have to go carnivore, but bring some beef in and give yourself permission on that. You'll feel better.
Yep. I'm going to have some ground beef with onions and avocado when we're done, and rice.
Oh, nice.
That's my favorite. That's easy. If you're listening to this, you heat up some rice, like some jasmine rice. You can get a package of it, whatever, cut it in half. You put some ground beef on it, put a little bit of coconut aminos, throw some avocado on there, some salt. You're in, girl. Okay.
Yep.
So the next question, what is one thing that anyone can do for their health that is completely free, that's beneficial?
Go outside. Just go outside.
See the sun.
Just go outside. If it's cold and rain, I live in Oregon, you guys. Sometimes I don't know what time of day it is. It's so gray, but I still go outside. Like, just go. That's a game changer. I hid for many winters, for decades. I hid all winter long, and now I'm a big, these last few years, like, get the right gear. Just make sure you have the right coat. Get outside.
Yep. I saw that. I think that was on your list too. You're going to go outside every day, no matter what the weather was.
Yeah, no matter what.
Good. And then the last question is, what is one thing that you wish you would have known about your health 15 to 20 years ago that you know now and you would have done differently?
I would have absolutely been strength training the whole time. I would have been actively building muscle in the gym. If I knew the far-reaching impacts on my health, not just the ones that you hear about, all of us talking about. I'm talking calm mind, clarity of thought, strength and willpower, and just kind of a general badassery that you don't have when you're not strong. You know, like that. It's a superpower. Strength is a superpower.
I love it. Okay, so Dr. Tyna Moore, thank you so much for coming on and chatting with us. I know everyone will find this beneficial. If you guys don't follow her, we're going to link all of her stuff in her social media. She has a podcast as well, the Dr. Tyna Show, so it'll all be linked in the show notes. If you thought any of this was beneficial, so basically if you know a single other female, you should probably share this with them. Make sure that you like and follow us, and then join us next week on the next episode. Thanks.
Thank you.
I feel like this week's episode was full of so many great tips, just beneficial tips about life in general, hormones, metabolism, GLP-1 use, just life, feelings, and goals. And so I really loved doing this interview with Dr. Tyna. I know you can find someone to share this interview with. It was so impactful. So please, please share this interview with anyone that you think it would benefit. Make sure that you are following us on any platform you get your podcasts so that you get our episode when it drops every single week. Make sure that you leave us a review. Follow me on social media. Tell me who you want me to interview. Tell me what questions you want answered, because that's where I get a lot of this information for this podcast. And please remember that Modern Endocrine is now available to see patients in 33 states and counting. If you need a provider to talk to about any of this, if any of this resonated with you and you want to discuss hormones, you want to discuss microdosing GLP-1s, you want to discuss gut health, we would be honored to help you on that journey and help you become the healthiest, best version of yourself. So please reach out to us and become a patient as well. I appreciate your time this week. Thank you for joining me to become healthier, and I'll see you next week on the next episode.
The information presented, including any materials discussed, referenced, or linked within this podcast, are for general educational purposes only, not the practice of medicine. No doctor-patient relationship is formed from you listening to this podcast or utilizing any of the information provided. I am a doctor, but I am not talking to you as your doctor. The information provided is not intended to diagnose or treat health problems, or take the place of the professional medical care provided by your doctor. If you are experiencing any health problems, including problems you believe have been touched upon in any respect within this podcast, you should consult your doctor about the problems without delay. You may ask your doctor whether he or she believes the information I have provided would be helpful to you, but you should still consult your doctor immediately and follow his or her medical advice as your treating physician. I'm just here to provide you basic knowledge about the issues we discuss so you are more aware of them and can better discuss them with your doctor. That's why we call it Back to the Basics. Join me on the next episode as we continue our journey.